Bismillahirrahmanirrahim. I am Dr. Asma Kawal from the Government General Hospital, Samnabad. Today, my topic of discussion was for the topical application in the psoriasis. Topical application is the main part in the treatment of mild to moderate psoriasis and also an important part in the treatment of serious psoriasis. Their success or failure of topical treatment depends upon the what type of drug we are using for the topical application. What is the mode of delivery of the drug, either only topical or intralesional, either patient is applying sufficient quantity or not, and proper method of application of the drug is very essential for the successful of the topical treatment. Another important point in the success or failure of the topical application is the compliance of the patient to the treatment. Different topical therapies are which are being used nowadays in the psoriasis are emollients, topical steroids, stars, vitamin D and its analog, and topical retinoids. Emollients have wide range ranging from the runny lotion to the thick ointments. Commonly freely available emollients are white petroleum jelly, liquid paraffin, and silicone oil. White petroleum jelly and liquid paraffin are a little bit more oily and messy, and silicone oil is available in fine preparation but is less emollient effect as compared to the prior two. These are the commercial available emollients which have white petroleum jelly, liquid paraffin, glycerin, and other additives, pre-formed forms. The crude forms are less expensive as compared to the commercially available form. These are the different commercially available emollient preparations in the forms of gels with prices ranging from 100 to the 200. And these are the prices of crude white petroleum jelly, which is 160 rupees per kg, and liquid paraffin about 200 per liter. So these are more economical as compared to the commercially pre-formed forms, especially in the patient where large surface area is these are tars are an important part in the topical treatment of the psoriasis. Nowadays, on the body tar applications are less commonly applied. These are the liquids which are available for the scaly psoriasis scalp. These are megatar liquids, polytar, which is not available in the market nowadays, photonic tar, T-gel, Hydar, and Meditar. Tar has effect on reducing the scaling and also anti-inflammatory, anti-proliferative effect on the psoriasis. Steroids are important part in the topical treatment of the psoriasis. Steroids are available in mild, moderate, high, and very high potency. Steroids can be used in concentrated form as well as in the diluted form. When we dilute the steroid with any other emollient as liquid paraffin or white petroleum jelly, these emollients give the occlusive effect to the steroids, so they become more effective as compared to the singly applied. When we dilute the steroids with the emollient, they become more economical to the patient, especially when large area have to be treated. And because they become more economical after the dilution, patients become more compliant to the topical treatment of the psoriasis. And various studies and reference from the experiences shows the efficacy is comparable to the concentrated form of the steroid. So we will prefer the diluted form of steroids to be applied. The steroid preparations are available in different forms: ointments, creams, and lotion. Ointments are the preparation which contain highest amount of the lipids, so they are ideal for dry and more scaly skin lesions. Creams contain the moderate amount of the lipids, so they apply to the wet lesions and body folds. Lotions are ideally for scalp and hairy areas because they easy to apply and easy to wash away from the hairy areas. These are the different preparation of the steroids in the ointment form, lotion forms, as well as in the forms. Now some other pulse for the topical application in the steroids. Avoid potent topical steroid on the face, armpits for the long period because these areas are thin and systemic absorption cancer, and cutaneous side effects are also more common on these sides. So we should use potent topical steroid on the face and armpit for 2 or 3 weeks, and of 1 week off period is essential to avoid the side effects. Potent topical steroids are also ideal for the palms and sole psoriasis. A Cluian can enhance the effect of the psoriasis, which can be done in the hand areas with the gloves and on other body surface area with clean plastic sheets. Now, what is the fingertip unit? It is very essential for the dispense of the drug to the skin. Using the 5 mm nozzle extending from the distal crease to the ventral aspect of the fingertip. It is the fingertip unit, and this quantity of drug is enough for the two hand area of the. This is the fingertip unit extending from the distal finger crease up to the ventral surface of the arm, the ventral surface of the finger. Know how much fingertip units are required for different body surface area. For infant, one fingertip unit is enough for the face and neck, and for upper limb, one lower limb 1.5, and trunk 2.5, and whole body. These are all figures which are needed to treat the different body surface area according to the age of the. This is the little description of the emollients and creams which I already described. Emollients have a wide range from the running lotion to the thin ointments. Lotion and creams and ointment differ from each other due to lipid content to the oil. Lipid content is lowest in the lotion, intermediate in creams, highest in ointments. High, it is the general rule. Higher the lipid content, greasier, thicker, and shiny, but more the drug works when it contains the more lipid in its formulation. Now, what is how we can dilute the drug? Always mix similar form. Ointment is oily base, so we should dilute it in oily drug to complete its dilution and mixing. Always mix creams in creams, lotion in lotion, or water-based preparations, or lotion can be used in the pure form. This is the method I want to show how we should mix the similar form in the similar. This is the liquid form, and we are adding the sorry liquid paraffin, and we want to mix it with the lotion. It is not completely possible to mix the lotion in the lipids as liquid paraffin. So it is proved that for complete mixing you should dilute both things used in the same base, oil in oil and water in water. Now, how to apply the drug to the body? Always apply the drug in the direction of the hair. It is very essential to avoid the common and major side effect of topical application, which is the folliculitis. Rub and massage gently. To this video is showing how we should apply the drug to the body. This is the fingertip unit we are taking. Now apply the drug gently and apply in the direction of the hair with gentle rubbing and massaging. Thank you very much.
Thank you, Dr. Asma, for this remarkable presentation. Now the house is open for question answer session. Any questions? Okay.